Hey guys, I'm super excited today to talk to you about the complications that can occur postoperatively to the surgical patient. So, what are postoperative or post-op complications? So, these issues that are going to occur, they're going to occur after surgery. So, exactly when? Well, these issues can be immediately, they can be early post op, or even late in the post op period, and they can be due to the actual surgical procedure, anesthesia, or even a pre existing condition, or for an unknown reason. So, obviously, patient safety is what we are always striving for. So, knowing the complications that are possible and having knowledge of the actions to prevent and treat are how postoperative nurses accomplish this. All right, guys, so there are quite a few issues that can occur to the postoperative surgical patient at various times following surgery. In the following slides, we're going to look a little closer at some specific complications. So, as you know, airway is always the most important. Because surgical patients often receive anesthesia, we're always super concerned about airway in the immediate postoperative period. Airway obstruction is one of these complications we watch for. Sometimes, guys, because of muscle relaxants and anesthesia, the patient's own tongue obstructs the airway. Because of this, the patient might snore and they might start to desaturate. We will stimulate the patient, position the patient on the right side, which is the recovery position, as it moves the tongue forward and opens the airway, or possibly do a chin tilt. So, a few more respiratory complications that are common that we must consider are laryngospasms and bronchospasms. As you can see here, a laryngospasm occurs when there is something irritating the vocal cords. Patients can present as being very agitated, have a decreased O2 sat. They can make a crowing sound if there is a complete obstruction. The first step is going to be removing that irritating stimuli. So if there are secretions, the patient may need to be suctioned. Also, hyperextend the patient's neck, provide oxygen, and notify anesthesia because the patient may need medicated and possibly re-intubated as a last resort. Now, bronchospasms are also common where the bronchial tubes are spasming, which can cause wheezing and difficulty breathing. The first choice of therapy for this issue are inhaled bronchodilators. Okay, so post-operative complications can also include cardiovascular issues. Hypotension is one of these complications, and it's typically due to hypovolemia or blood loss because of the surgery. Common actions are to replace IV fluids or even give the patient blood products if necessary. Hypertension is another issue that occurs, typically caused by pain or even volume overload. Now, guys, pay special attention to if this patient had hypertension pre-operatively, because this might be why this issue is occurring. If hypertension is due to pain or volume overload, you may give the patient pain meds or even diuretics. All right, guys, so post-operative nausea and vomiting, or PONV, is a super common complication that we see. In fact, it can occur in up to 30% of surgical patients. So what causes PONV? Well, being a female actually increases a patient's chances, as well as having a history of motion sickness or a previous bout of PNOV. Also, guys, some medications that we use to put the patient under anesthesia can increase this risk. So hopefully, post-operative nausea and vomiting is identified by the patient in the pre-operative period so that the anesthesia team can try their best in preventing this from occurring. They will often use antiemetics like Zofran or a scopolamine patch to help decrease this. Guys, this is a super important complication to try and prevent, as it can increase the length of the post-op stay for the patient and is extremely discomforting, as the patient is also dealing with a new surgery. So pain is probably the complication that patients are most concerned about. Remember, pain is subjective to the patient, and we believe what they tell us. Follow your facility's policy with pain control, including assessment scales like a numeric rating scale or a visual scale, and always remember you need to reassess your patient. So we treat the patients with pharmacologic interventions like pain meds, and also pharmacologic interventions like repositioning and reassurance. So, as weird as it may sound, sometimes anesthesia creates urination issues in patients. Either they physically can't or they just do not feel like they need to. Sometimes this is anesthesia related or even surgery specific. It is a good idea to encourage the patient to try to go to the bathroom even if they feel like they don't have to. Sometimes, though, it is necessary to straight cath the patient or even give certain medications to get things going, so to speak. All right, guys, embolisms or any blocking substance like a blood clot, a fat particle, or air can create issues in our patients like deep vein thrombosis or DVT or pulmonary embolism, a PE. We always need to be following our facility's DVT prophylaxis protocols, like the application of compression stockings or sequential compression devices or SCDs to prevent this issue from occurring. So know the signs of these issues like pain, redness, swelling to an extremity, or shortness of breath. And of course, you are going to notify the provider if you suspect this. Excessive blood loss or hemorrhage is also a serious postoperative complication that must be addressed. PACU RNs are very, very good at assessing the dressings and also managing the patient's drains to monitor blood loss after the surgery. Guys, if a patient is saturating dressings very quickly and frequently, the provider must be notified. It is possible that the patient might have to return to the OR. So guys, infection is most definitely a critical postoperative complication that you might not see. We might not see it until late postoperatively. Surgical site infections typically occur within 30 days after the procedure. The surgical area may be red, it may be tender, there may be discharge or pus, and the patient might have a fever. Steps are always taken to prevent these issues from occurring, so be sure to check out the lessons available on the sterile field, surgical prep, and intraoperative nursing priorities. Prevention is key. Notify the provider if an infection is suspected. The patient will most likely be treated with an antibiotic. Okay, so what about surgical site complications? I just want to mention that thankfully these issues are not too common, but you do need to be able to recognize them. So wound dehiscence and evisceration are issues that need to be handled immediately. Guys, dehiscence is the separation of a surgical incision that typically occurs to abdominal incisions because of increased abdominal pressure from coughing, sneezing, or bearing down. You can see an extreme case of wound dehiscence here in this picture. Wound evisceration is a medical emergency and should be treated that way. This is when not only is the surgical site separated, but there is protrusion of bowel and or abdominal organs. Guys, a few things need to happen. You need to assess your patient because this complication can cause shock. You need to apply saline-soaked dressing in a sterile fashion, and you need to notify the provider. Guys, the patient will most definitely be returning to the OR. It is not uncommon to have a patient who is just waking up from anesthesia postoperatively to be a little confused. So cognitive issues like agitation, confusion, or emergence delirium are common. I probably see this in a patient a couple of times a week. So some common causes are hypoxemia, anesthesia, and pain. Guys, typically reorienting the patient helps to resolve these cognitive issues, but you can also giving the patient oxygen and pain medications will also help. So postoperative hypothermia is a complication that is common to the postoperative patient and is defined by a temperature that is less than 96.8 degrees Fahrenheit. So cold, guys, very cold. Usually this occurs because of anesthesia and is even more common when surgeries are lengthy. Shivering is a common indication. And actions that we use to treat this in our patients is by rewarming the patients with blankets and warming units. Be sure to check out our lesson on intraoperative complications where you can learn even more about perioperative hypothermia. Okay, guys, so what nursing concepts can we apply to post-operative complications? Obviously, our goal is to always keep our patients safe, and with oxygenation, it is extremely important. Pain control, it's a huge concern in the postoperative period and something that we focus on to keep our patients comfortable. Okay, let's look at some key points. Postoperative complications occur after surgery. They can be due to anesthesia, the surgery, or other comorbidities. They can be at different times, but we should know the possibilities and the actions to prevent and treat. Respiratory complications can be laryngospasms, which occurs with an irritant to the vocal cord, and bronchospasms, which occur when the bronchioles are spasming. Cardiovascular complications can also occur, like hypotension, which is usually because of hypovolemia, and hypertension, which can be from pain, anxiety, or volume overload. Cognitive issues like agitation, confusion, and delirium can occur usually due to anesthesia, so reorient the patient and provide pain management if necessary. Embolisms are also a complication which can result in a DVT or PE. You need to follow your facility's DVT protocol. Postoperative hypothermia, where the patient's temperature is less than 96.8 and they're very cold, the patient might shiver. Warming interventions should be utilized. Excessive bleeding or hemorrhage is another complication where the provider should be notified, as the patient may need to return to surgery. Finally, postoperative nausea and vomiting is super common. Antiemetics and fluids are utilized to treat and prevent, and surgical site issues like dehiscence or surgical site separation and evisceration or protruding organs is a medical emergency, and the provider should be notified immediately. Okay, guys, I hope you enjoyed this lesson on postoperative complications. Make sure you check out all the resources attached to this lesson, as well as the rest of the lessons in this course. Now, go out and be your best self today, and as always, happy nursing.